Okay, welcome again, everyone, to the day in the life of a developmental psychologist. Today we have Dr. Elizabeth Matthews with us, and we're lucky enough to have Dr. Matthews teaching in not just our Bachelor's in Psychology program, but also our new Master's in Psychology program. So I want to read you just a bit about Dr. Matthews' background, and then I'll turn it over to her, and she's going to give us the insight of what it's like to be a developmental psychologist and some different paths that students can take. So Dr. Matthews presently serves as a full-time assistant professor at City College in the Division of Interdisciplinary Arts and Sciences, as well as an adjunct assistant professor at CUNY SPS in the psychology program. And she's also at City College's School of Education in the Early Childhood Graduate Program. She has extensive experience working with children with disabilities, and she served as a developmental specialist, providing developmental assessments of children born prematurely at the Columbia University campus of New York Presbyterian Hospital. Later, she served as executive director of Project Happy, which is a nonprofit program providing tuition-free services for children and youth with physical disabilities and autism. Dr. Matthews earned her PhD in psychology from the City University of New York's Graduate Center. So I'll turn it over to Dr. Matthews, and again, thank you for joining us, and we hope that you enjoy the presentation.
Hello everyone, and good evening. I'm really excited to be here with you all tonight to talk a little bit about my process going from undergraduate student in psychology to developmental psychologist, and a little bit about how that happened for me, as well as talk with you about some options in the field of developmental psychology, specifically what I was doing as a developmental specialist in a hospital setting. So hopefully this talk will give you some ideas about, potential options for yourselves, or, just give you some information on developmental psychology as a field. My email is here if you have any questions after the, there will be a Q&A after the presentation, but if something pops up, later down the road and you want to ask a question, you are more than welcome to send me an email and I'll be happy to respond to you. So the first thing I just want to talk about a little bit is, conceptualizing your psychology career path. And there's, I think, sometimes a misconception that, you're going to know exactly what you want to do right from your first psychology course. And that's, I think, not really how it works out for most of us. For most of us, I think it's more of a process that evolves over several years, and as we get exposed to psychology and to different courses and to different opportunities, we see ourselves narrowing our focus and really developing our specific interests and passions. At least that's how it worked out for me. When I started college long time ago, I actually started as a pre-med. I wanted to be a pediatrician, but I had some difficulties with my chemistry classes, although I did very well in my other classes. And at one point, I was really getting very interested in psychology as an undergrad, and so interested that I actually started taking some graduate level courses. And probably when I was about a junior, I would say, in college, I decided to major in psychology, and then shortly after didn't really have a clear idea of what I wanted to do career-wise, so I knew I was very interested in children's development and like in educational psychology, so I decided to go into a master's program that focused on developmental psychology and cognitive psychology. So that's what I did after I earned my BA. And when I was in graduate school, I had some wonderful opportunities to do research, and I was actually working on a big research study that looked at the outcomes of Early Head Start, which is an educational program that's provided to preschoolers. And I became really interested in this, and also interested in the research component of psychology. So at that point, I decided to continue on for my doctoral degree. At about the same time, I was doing some observations in a hospital setting. This was before I even started my doctoral program. I was at the tail end of my master's program. And I was actually doing some observations of a feeding clinic that was working with children who had failure to thrive, which means they don't grow well when they're infants and toddlers, and they often don't take in nutrition due to medical issues or sometimes psychological issues. So this particular clinic was using some principles of operant conditioning, which you may be familiar with if you've taken an introductory course. But basically, by providing positive rewards to children, the programs was designed to help improve their caloric intake and also their enjoyment of mealtime. So I was doing some observations in this clinic, and I was really interested, and I wanted to see if I could get in on the research team, but they didn't have a spot for me. At the time, there was going to be a bit of a wait, and it was suggested to me that I consider volunteering in the developmental clinic, which was down the hall, just to get some experience. So I thought that was a great idea because, you know, I was really interested in early development of children. And I started volunteering in this developmental clinic. And literally about a month into the volunteering, I was hired as a first part-time and then later full-time developmental specialist. And I'll talk more about what I did in that role in a moment. But I just wanted to start off with this story to demonstrate to you that there is sometimes what you end up doing isn't quite what you initially conceptualized that you would do. So if you are still debating with yourself exactly what you want to do or you feel unsure, please don't have anxiety over that because it's completely normal for you to feel that way, and you can certainly be very successful if you just follow your interests and your passions. And then, you know, after a couple years working in the developmental clinic, I went on to do other work specifically with children who have autism and physical disabilities and ran a program. And I then transitioned into academia, which where I am now. So my career path over the last, I don't know, 14 years or so has taken many different twists and turns. So that's actually, I think, part of the real appeal of psychology is that it's such a flexible field. You can do so many different things. So the first thing I think when you want to conceptualize, well, what am I going to do with psychology as a degree? And maybe people might even tell you, well, oh, psychology, you can't do anything with that. That's really, that's a real, you know, misconception. There's actually a lot you can do at all levels, whether it's BA, MA, or, you know, PhD or licensed practitioner. It's just a matter of knowing what actually is available to you and what different career options you can do at the various academic levels that you're at. There's also what we call, you know, sort of traditional and non-traditional pathways, meaning that, you know, sometimes you go straight into, for example, a PhD program in clinical psychology, which is training you to be a clinical psychologist, and other times you might start in a non-clinical field and then later on do like a respecialization in a clinical field if you feel that that is going to benefit you down the line. So there are many different ways to obtain the credentials that you need, and you don't always have to do them right from the get-go. there can be a great benefit in developing experience in multiple areas of psychology. In thinking about what you want to do with yourself, you also should really consider your strengths and challenges and interests. And psychology isn't just about working with people with mental health issues or doing psychological research. There are many, many, many different avenues for people who have a psychology background. For example, you can work in the healthcare field, health psychology, developing programs for people who have chronic illness to help them cope better. You can work as a researcher in health psychology. You can work as a developmental specialist, as I did, or you can work as a clinical psychologist in the healthcare field. The geriatric field is exploding and looking for people who have a good understanding of psychology, and in particular developmental psychology. Many psychologists work in the business area, helping employees with productivity, helping managers deal with cultural competence, and helping develop a positive work environment. You can be a researcher and conduct research. There's also a lot of opportunity in IT and other like innovation areas. Developmental psychologists are used a lot in the gaming industry to understand like how to develop specific games that will be of interest to youth and adults and young children. And education is another great area where psychologists can work either doing research or working as a school psychologist or working as like an instructional designer with a cognitive or developmental psychology background. So there are many different options for you. So this presentation focuses on developmental psychology and, what is a developmental psychologist? Well, it's somewhat of a broad field because a developmental psychologist can work with people or in research across the lifespan. So it can be research with infants through end-of-life issues. So there's a huge span of opportunity there. And as I said, there are a lot of different opportunities for developmental psychologists. In general, they tend to focus on these areas that I've highlighted here. Child life teams that help children who have chronic illnesses, clinical work. Early intervention programming is a huge one because it's a federal program that all states are required to have. And early intervention specialists often do have a psychology background, usually at the BA level, and they actually coordinate services for children with developmental delays. It's a really exciting field and with a lot of potential growth. Geriatric programming, as I mentioned, research and education. So I'm going to talk a little bit about what I did as a developmental psychologist, and I worked at the Columbia University campus of the New York Presbyterian Hospital, which is up in Washington Heights, and I did this for about 5 years. And I started, as I said, as a volunteer and worked my way up fairly quickly to a part-time position and then a full-time position as I continued with my psychology training. So what I specifically was responsible for was conducting assessments of children who were born at that hospital but who were born prematurely. And at that hospital in particular, they have an excellent neonatal intensive care unit, one of the best in the country. So they have a lot of medical technology that can make a big difference in saving the lives of babies who are born too early. Back when I was working there, we were seeing babies who were living even though some of them were born at 22 weeks gestation, which is really, really, really small. Many of them weren't even 1 pound in weight. So what my job was to assess these children from the point of discharge after they were let out of the hospital, which for some of them was a long time, sometimes up to a year they had to spend in the hospital getting surgeries or treatments just so that they could be healthy enough to, go home to their parents. So I would conduct regular assessments, developmental assessments, and if I noticed that there was something that, the child wasn't developing according to, what the general expected framework is, there would be early intervention services or other types of services that I could recommend and or coordinate with other members of a interdisciplinary healthcare team. So I had access to pediatricians and geneticists and physical therapists and speech therapists, and we would coordinate among each other to talk about the child and his or her needs and how we could develop a plan that would allow the child to maximize his or her development. The important thing to note is that it's really essential to intervene as early as possible, even if a baby is very young, because the majority of brain growth happens in the first 5 years of life. So the earlier you can intervene with needed services, the better the chances that the child can maximize his development. And this is really important work. I would also work with the therapists and coordinate the different therapies and services. If a parent was having a challenge getting in touch with the therapist or with the coordinator, I would intervene. I would also counsel families and parents in particular, because a lot of them would be very fearful of caring for their child because their child had been so sick. And as a child grew, sometimes parents were afraid, for example, to set limits or to discipline because they would feel that, their child survived this, terrible ordeal so early on, and they were afraid to, have any kind of limit setting, and sometimes this would lead to behavioral problems aside from the prematurity. So I would do a lot of parenting workshops aside from my work in the hospital, and just kind of counsel parents on parenting techniques and help them express some of their fears or concerns or reservations about parenting. Um, a lot of premature infants also are often born of like a multiple gestation, like twins or triplets or quadruplets in some cases. So a lot of times we would do specific parenting sessions on like how to parent your quadruplets, your multiple, because that can be a huge challenge. So it was really, every day was a little bit different because the cases would be different and the teams would be different and the needs would be different, which was really what made it for me very exciting and interesting, because I really wasn't doing the same thing every day. The other thing that I did was I would make rounds in the NICU so that I could learn about the different children and what was going on with them medically, and meet their families before they were discharged so that they would get to know me and get to know what kinds of services were awaiting them after the discharge. So that was my job. It was, like I said, it was really enjoyable, and I really, I was there for several years, and I thought it was a great fit for my interests and my skills. The other thing that was also really cool about this particular position was that there was a lot of clinical research done at that hospital because it was affiliated with the university. So sometimes I would get to be part of the clinical research team and give them data, which was really interesting. And finally, I would, write reports on the children and, different case studies. So the case studies would be presented, for medical students or residents, and they would, ask questions, and then this would help their learning as well. So as I said, it was a very rewarding field. I loved helping families, and I loved seeing the infants who had been born so sick develop and grow, because I would follow them often until they were, you know, well into early childhood, 3, 4, 5, sometimes 5 years of age. And I felt often I was able to make a positive difference for a family. Of course, as with any job, there were some challenges. NICU infants are often very ill. So when you're seeing a child in the hospital and they're hooked up to a lot of machines and tubes, it can be really sad. And you can feel a little, sad seeing that every day. And parents are often under extreme stress, and sometimes, they are not sure how to manage that, and that can, feed off on you as a developmental specialist. And the other thing that can be a little bit concerning is that while there are a lot of services available for children, there are still local and national policies that are continually in play, and sometimes the support for these social services is cut. And through my period of time working at the hospital, I did see a lot of social services cut and the criteria for disability increase so that fewer children were able to get services. And that was really a difficult thing for me because I wanted to ensure that all the kids could get services, and it was getting harder and harder as the years went by to do that because the services that are governmentally sponsored were continually at risk for cuts. So a lot of times students will ask me, wow, this sounds really interesting. Some of the other, options that you talked about also sound really interesting. But how do I get experience? Because I look at jobs and they all say, well, you need to have experience or you need to have a degree. And how do I get my foot in the door? Because I want to try some of these things out and I don't know how to get started. Well, the first and I think the best way to get started is by volunteering if you can. You don't need to make a huge time commitment, and you can often do volunteering on the weekends. Most hospitals and clinics love to have volunteers. In fact, when I was the executive director of Project Happy, the only way we could actually afford to offer free services to children and their parents was by having volunteers work for us. Virtually none of our staff was actually paid. We had over 100 volunteers, mostly college students, psych students, speech therapy students who work with us, and we ran our program on Saturday, so it was perfect. Students would volunteer one day a month, and it's really great because when positions would open up, we'd often pull from our existing volunteer pool because, one, they knew the organization, and two, we knew their level of commitment. And the same thing happened to me when I was volunteering as well. I was hired literally within a few weeks of starting as a volunteer. You don't have to necessarily even volunteer directly in a patient-oriented setting. You could, if you speak other languages besides English, you could volunteer as an interpreter in a hospital because they often desperately need interpreters for every and any language out there, especially in New York City or another big city if you live close to a big city. If you're not New York local, I would definitely consider volunteering your services because, again, when positions open up, most organizations will draw from the people that they know. And you may even get a heads up as to what positions are coming available before the general public. Another great way to get yourself, one, knowledge in the field, and two, kind of connect with other people, both hiring and people like yourself, is to join the APA, the American Psychological Association. There is a student membership which is fairly affordable, and you could just go on to the apa.org website and look at the student resources and the membership options. Often there are conferences and activities specifically geared towards students in job searching and in connecting with psychologists and people working in the field. And again, if you get to know people, that you can get recommendations, you can get inside information on what's available and on your specific interests. Another thing to consider is if you really want to do something that's clinically oriented or in healthcare, take a look under psychiatric technician, which is sort of like a new term that that a lot of hospitals and clinics are throwing out there. And most people who work as psychiatric technicians do basic work in a residential facility. It could mean like helping residents, get from activity to activity, assisting nurses and doctors, helping people who are running programs. It is considered somewhat of a basic skill job, but again, great way to get recommendations, great way to get involved on the ground level if you're really interested in clinical psychology and to demonstrate your commitment to the field. Again, a BA in psychology or just obtaining your BA, meaning in process, can get you a job like this. So again, if you're interested really in direct kind of patient care, this can be a great thing for you to take a look at. And a lot of people don't really know that that's actually what the term is, psychiatric technician. And another way, obviously, is to connect regularly with the faculty at SPS, because a lot of us are working in the field or have worked in the field. We have connections. We write recommendations for students either for future education or to recommend a student to a position or for a volunteering position. So the better the faculty get to know you, the better, personalize that recommendation or that advice can be. So don't be afraid to, send an email, talk about your interest with the faculty member, and let them help you. I know that was a pretty speedy presentation, and I went over a lot in a fairly short amount of time, but I wanted to have some time for people to ask questions about the field or about anything in my presentation, and I'd be happy to go over anything in more depth or answer specific questions that you may have.
So feel free to type in your questions and send them. I'll read them out loud, and then Dr. Matthews can answer them for you. So any questions that you have about her presentation, about the field of developmental psychology, about, the educational path in general, we're happy to respond. So we'll give it a minute and allow people to send in their questions. Okay, so we have a question, and again, while we're reading these other questions, feel free to send yours along as well. So the first question is, what do graduate schools look for in a candidate for master's or PhD programs?
Well, that's a great question. So there is usually a pretty big difference between a master's program and a PhD program, because a master's program, usually you're still, you have like very specific general tracks. Like for example, here at SPS, we have, a general track, we have a developmental track, we have the IO track. So students can apply into one of these tracks, and we don't necessarily expect at this level that you have research experience or that you have everything kind of figured out in terms of, what you want to do with your degree. At master's level, you're still sort of in that exploratory phase. So really what is being looked at are just your undergraduate psychology courses, whether you're kind of coming in with a psychology background, GPA, and personal statement, just to see that you are interested in, the options that are offered and that the program could be a good fit for you. At the PhD level, it's a little bit different, because usually you're going into one of two tracks. Either you're going into a clinical track for a PsyD or a PhD in like clinical psychology or school psychology, something that's leading to licensure, or you're going more the research route, which can encompass, many different areas like developmental, IO, biological psychology. There are many different areas. So usually, if you're going towards clinical, what they're looking for is that you have some experience either with people who have mental health issues. They're looking at your personal statement to see that you have the maturity and the understanding of what's involved in being a clinical or a school psychologist. They're looking at your recommendations. They're looking at your grades, whether if you're coming from a BA or from an MA. They may be looking at test scores if they require test scores. So that's usually what they're looking for in a licensure-oriented program. In a research-oriented program, what they're looking at is to see that your interests align with what they offer. So usually when you're applying to a PhD program, you look at what the faculty is researching, you look at what tracks are offered, and you look to see how your interests in research and future education fit. And that's really what they're looking for in a PhD program is fit. They're looking to see that you've researched the program, that you have a plan for what you want to do or maybe research, and they want to know that you're going to be a good fit. Of course, they're also looking at grades and so forth, but I would say probably the most important thing is the actual fit between your interests and the school's interests. So that's the two different things. I also just want to point out that there are a few licensure track programs at the master's level like school psychology. So that's also another potential option. And again, any licensure program, they're looking for maturity and looking to ensure that you understand what it's like to work with the population.
So the second question is there a specific path where education and developmental psychology meet?
That's another great question. So within developmental psychology, there is an educational pathway. So many developmental psychologists do actually work within educational psychology. There's a lot of overlap between the two fields. If you're interested in how educational programs impact children's development and their learning, or even adults' development and learning, because adults develop too throughout the lifespan, then certainly one could pursue either a developmental master's and or PhD or an education master's and PhD. It really is a bit of personal preference. I will say though that if you really like the psychology aspect of it and want to have the opportunity to take courses in other fields in psychology, then your best bet is going to a psychology master's program rather than an education program, just because of where the focus is. So that's just my personal advice, but there is definitely overlap, and there certainly is overlap in developmental psych with, I would say, almost every field, whether it's biological psychology, even IO, because a lot of what goes on in developing, healthy workplace practices has to do with understanding where people are, developmentally.
The next question is, to be a psychiatric technician, do you need special training, and how do you get started?
Another great question there. So this psychiatric technician term is fairly new, and right now most states don't have any kind of certification or licensing for a psychiatric technician. I believe the only state right now that has actually a certification program for psychiatric technicians is California. But other states have adopted the same lingo. Basically, what most hospitals or residential facilities or clinics, mental health clinics are looking for are people who have some background in psychology. So either they're currently in a BA program or they've just finished a BA program, people who are interested in working with people directly. And usually the training is done on site. So usually you're trained as part of the hospital or the clinic's protocol. And you will draw upon your understanding of psychology and, combine that with your training and also with the protocols that are there in the clinic to work with people and, kind of see how you enjoy it.
Great. So the next question is switching gears just a little bit. So with respect to the research route, are there many programs out there that focus on theoretical psychology rather than designing and conducting experimental research?
That's another great question. You can certainly do, theoretical research, which actually is research as well, because usually what you're doing is either coming up with a new paradigm or combining two theories or maybe taking a theory and sort of deconstructing it or challenging it. So it's actually very challenging to write a theoretical, thesis or dissertation, but do it. A lot will depend on the specific program. Some will have faculty who have done theoretical work. I will say that at the Graduate Center at CUNY, there are a number of people who do follow a theoretical pathway. But as you explore different programs, it's something certainly worth asking faculty. When students are pursuing or beginning the process to pursue a PhD, they often do interact with faculty. They will email them, they will attend information sessions, they will learn about the programs often in great depth. And in addition, there often are several interviews that are involved as part of a PhD research program application process. So it really is a very individualized thing, school by school, but certainly there are many students who do theoretical research. In addition, there are a lot of students who do qualitative research, which is not experimental research. It is study-based, where they're going out and they're collecting data, but they're sort of looking at phenomenon and how, like people's lived experience rather than, conducting experimental research. I would actually say that experimental research in itself, unless you're going to be working as part of a larger, big study, is pretty rare for a dissertation just because of the expense and the time involved in that particular kind of research, or if you're working, if you're going to a program where there's like an animal lab and you're doing, experimental research in psychology, with animals or as part of another professor's work.
So someone asked, first they said, thank you very much, this is very interesting. So we're glad that you're getting a lot of information out of it and that you're finding it so exciting. The question is, could you talk a bit more about working with autistic patients?
Yeah, sure. So I actually did work with autistic children both at the hospital and as part of working at the Project Happy. So at the hospital, sometimes there were children who would exhibit behaviors consistent with autistic spectrum disorder. We would find this out as part of their developmental assessment. And of course, in understanding how important it is to begin services right away, we would often recommend that children, where there was that suspicion, would obtain like speech therapy usually, and sometimes behavioral therapy immediately. So one sort of confounding factor is because a lot of the, or nearly all of the children who we saw as part of this clinic were born prematurely, many of them have pre-existing neurological disorders as part of their prematurity. For example, they may have had like a bleed in their brain when they were born. They may have had a very difficult birth where there was trauma and then brain injury. So sometimes we weren't really sure if the behaviors were, sort of separate autistic spectrum disorder, or maybe perhaps the sequelae of the other neurological issues that they were facing. But definitely regardless, we felt it was very important to begin the services immediately, so that was really our first priority. And the good news is that when children do have the needed services and when they do begin them early on, you often do see a lot of improvement in language development, improvement in their ability to communicate with others, and improvement in their ability to develop interest beyond, like the very limited scope that's often seen with these children. When I worked at Project Happy, initially we didn't have a program for autistic children. We had a program that was basically geared toward children with physical disabilities, so children who maybe had cerebral palsy or paralysis. And what we offered them was recreation activities, because a lot of times children with physical disabilities, they don't have opportunities to play in a park because the park doesn't have like adaptive equipment to allow them to play. They don't necessarily have all the same, opportunities, especially in a city like New York, where, imagine it can be very difficult for someone in a wheelchair, to find elevators at, different places that they want to go, because they don't always exist. There have been improvements certainly in ADA compliance, but it's still far from perfect. So what we did was we offered activities like swimming and bowling and tennis that were all adaptive for children, whether they were using a wheelchair or had a walker or crutches or cerebral palsy and maybe just had difficulty walking. And at the same time, because they could spend all day playing, the parents could either attend workshops that were held by a social worker, or they could just go and run errands. Because a lot of times, like parents, their time is so compressed, they could have like a nice 8 hours just to like go and do what they needed to do. We also provided free transportation to and from the center, so that kids didn't have to worry about like getting on a subway or getting on the bus. Like we had actual transportation for them. So we didn't have the autistic program initially, but because we were completely grant funded, we came into contact with an organization that wanted to give us money, but wanted to give us money to develop a program for autistic children. So in doing so, what we decided to do was focus on social communication through like art therapy. So we actually developed a whole arts and crafts program for autistic children and youth, and it was run by, basically, again, volunteers, people who were doing a master's degree in psychology or a BA in psychology or an education or an ABA, and they would be trained. We did have, someone on staff who, was a trained psychologist, and they would be trained, and they would, run the program with the supervisors, and we then would collect data, to demonstrate the program outcomes, and we found that there were some real good benefits to having this social time for children, and the same benefits for parents too, that they didn't have to worry about the safety of their child. They were able to talk with other parents, have conversations, get some social support if needed, again, or just go out and like do the food shopping. Because again, it's these little things sometimes that, you know, can make such a big difference in a parent's life, and we could offer them, you know, some of those opportunities. But it's very rewarding because, again, you know, you can see really good improvement uh, in the development of an autistic child, provided you have the right services in place.
So our next question is, if you wanted to pursue an MA in psychology with a concentration in developmental psychology, are there career options, particularly in the field of developmental psychology, available on an MA level? And I'm glad someone asked this question. For those of you who aren't aware, we do have a master's in psychology program here at the CUNY School of Professional Studies, and we have two concentrations. One is in IO psychology and the other is in developmental psychology. So I think this is a great question because it directly relates to CUNY SPS and really what some of the students that are currently enrolled in our program might be doing after they finish.
Yes, I second that. A great question, and the answer is absolutely. There are a lot of jobs for people with an MA in psychology. Early intervention coordination, if you come in with an MA, if you want to work with children and families in that context, helping them arrange their services, counseling parents, doing the initial intakes, if that's something that's enjoyable for you, then while you can do that with a BA, obviously coming in with an MA puts you a bit ahead in the applicant pool. It may even mean more money or other, you know, sort of potential advancement within the organization. So that can be a great, great opportunity. There are also, you can work, for example, for programs that run educational programming for children. For example, you know, these different, like Baby Einstein and different things often do hire psychologists at the MA level to help do evaluation research, which looking at, you know, children's engagement with the programming, looking at, you know, how programming should be put together. So if you have an interest in that kind of area, you know, more like the IT or like, you know, media area, that can be a good fit. And certainly if you want to work like in child life, having an MA is an excellent option because, again, while you can work in child life with a BA, having an MA just gives you a little bit more flexibility, I will say, with the job search. In child life, most large hospitals have child life teams, and child life teams are people who you do have to go an extra step beyond the MA. You have to take an exam in order to get, you know, to get a certification. But you basically develop programs for children who are having surgery or are sick and in the hospital for an extended period of time, and you help them with basically all the things you can imagine, like, you know, assessing their development. Are they playing? Seeing what would help them, you know, feel better, answering their questions, or offering advice on how to talk appropriately to children about like a serious illness or a surgery, because kids are often, you know, very frightened, don't really understand what's happening when they have to go in to the hospital, and parents often have a lot of questions about how to talk to their child about, you know, what's going to happen without scaring them and without, you know, sort of belittling them either. So it's a really great field to get into. As I mentioned also initially, programming for the geriatric population in skilled nursing facilities or adult daycare centers. Again, great to have a background in developmental psychology, particularly if you have an interest in geriatrics. Also, most clinical research teams do hire people with master's degrees as people to work on the clinical research team. Certainly studies are developed by people with PhDs, but there are many aspects of research that can be carried out by BA and MA students and degreed psychology professionals. So there are actually so many options. It's really just a matter of, kind of focusing your interest and seeing what would be a good fit for you.
Great, and I would also add to what Elizabeth mentioned, which is that there are so many different options that students have in the field of developmental psychology, and I often urge students to look at search engines like Indeed or Monster.com or things like this, where you can type in MA in developmental psychology or MA in psychology, and you can see all of the postings for positions for which that is a requirement. So you can kind of get a good feel for what kinds of jobs are available in your specific area at any specific given time. So another question that was posted is it possible to be a therapist who also does research?
Absolutely, and there are many practicing psychologists and therapists who do research. Regardless if you want to do research, it's important to know about research, because if you're working with clients, you want to understand the newest research on how to help them. So that would mean that you would be reading studies. So you want to know how to evaluate these studies that you're reading and to see if they're going to be appropriate for your client base. But from both ends there, absolutely, research is an important part, even if you're not actually conducting it.
I think that transitions really well into the next question, which is, how well prepared would a graduate of CUNY SPS be for designing, conducting, and statistically evaluating experimental research? So I'll jump in a little bit on this question. I don't think I mentioned who I was at the beginning. I apologize for that, but my name is Carla Marquez Lewis, and I'm the director of not just the bachelor's program in psychology here at CUNY SPS, but also the master's program. So I can tell you that throughout our curriculum, and I would encourage all of you to look on our website, the MA page, and you'll see underneath my information a button that says curriculum. If you click on that, you'll see all of the courses that make up our program. You'll also see descriptions for each of those courses. And what you'll notice is that throughout the curriculum for this program, research is embedded in all of the courses. Students also take a research methods course, a statistics course. They design a thesis or capstone project, and that's a 2-semester project. One is about planning that project, and the other is about actually executing and preparing the project. So there's a lot of research that's embedded in every class, and then specific courses geared toward both research and statistical analysis. So when students leave our program, the idea is that they would be well suited to go into positions where research and data analysis are at the core of that role. Did you want to add anything, Elizabeth?
Yeah, I mean, that, of course, absolutely everything that Professor Marquez Lewis said is 100 spot on. And I also just want to mention that, actual experimental research is a really small subset of like the actual research that's done in the field. In order for something to qualify as experimental research, it has to have a control group, and there has to be random assignment of participants to, control and experimental conditions. And that is the bulk of what the jobs that require research skills are really program evaluation. And you would absolutely be well prepared for program evaluation even after taking, like, for example, Psych 201, right? That's the research methods course, because that really prepares you for qualitative and for quantitative and for understanding statistics conceptually. It's probably one of, I think, the best courses we have here. And then from there, then you sort of get, more of the fine-tuning in the more advanced courses later down the line, and then in the master's program even more so. But what most clinics and programs, whether it's media programs, companies want to know is that you can do program evaluation, that you can do evaluation studies. That's really where the bulk of the skill set is. Of course, clinical research in a hospital often is, especially like drug research and so forth, are experimental research studies, but experimental research studies really are an incredibly small component of like all the research that's out there.
And the last question, we have time for this one last one. The person asked, you mentioned the elderly and geriatric communities. Could you expand on what a developmental psychologist could do when working with older patients?
That's a great question. A lot of times when we think developmental psychology, we think more, about children and school-age children, and we really kind of tend to forget and neglect that we have, the rest of the lifespan. We are seeing, increases in the geriatric population due to, improved healthcare and medical technology, longer lifespans, and also we have a booming baby boomers aging. So there now is a greater emphasis on understanding the development of, the 65 plus, age range, and not only keeping people healthy psychologically and cognitively, but also understanding, for example, how activity can, reduce the risk for developing dementia or Alzheimer's disease, how having programming in adult daycare facilities or residential facilities or skilled nursing facilities can help improve outcomes for older clients, whether it's socially and emotionally or cognitively or even just in terms of their health care in general. So this really is I think that probably one of the really exciting areas of developmental psychology if you're interested in working with older adults.
Great. Well, thank you once again for joining us this evening to hear more about a day in the life of a developmental psychologist. If you have questions, again, feel free to reach out to Dr. Elizabeth Matthews. She provided her email information at the onset of this presentation. If you have questions about our program here at SPS, you can feel free to contact me, and my contact information is on our webpage online. So again, if you are thinking about a program or thinking about your path, I would just reiterate to do research, to join presentations and info sessions just like you did tonight, and really do your homework, learn about what it is that you're stepping into. And if you're already in a program, I noticed some of the people that are attending right now online are in our program, and maybe you have some more questions. Again, feel free to reach out, take a look at our website, look at the courses, and we hope that you find what you're looking for. So good luck, and thank you again. Goodbye.